Nearly half of patients aren't satisfied with the mental health treatment they receive, with women more commonly being affected than men. It's not about needing more drugs or better funding, it's about fundamentally missing the point of treating depression altogether. I'm Dr. Anthony Kaveh, an anesthesiologist and integrative medicine specialist. And if you're wondering why, of all doctors, I'm talking about depression, it's because patients tell me their deepest, darkest secrets, sometimes secrets they've never told anyone else in the world when they're in the altered state of consciousness receiving anesthesia, including ketamine in my ketamine infusion center. And with the over 10,000 patients I've treated, I can write volumes of encyclopedias based off the secrets that patients with depression have shared with me. But I value your time, so here's the 6-minute version of what patients with depression share with me and how what they're looking for is different than what doctors and big pharma are typically providing them. First, you need to understand that anesthesia is not sleep. It's a deep medical coma that takes you to the edge of death. It's the closest we regularly get to near-death experiences, and what patients share with me when they're on death's doorstep can be very precious, especially as that altered state of consciousness slowly kicks in with the anesthesia. What patients talk about isn't more followers or fame or Benjamins or a bigger house. They instinctively and spontaneously start telling me about what brings them meaning and connection. I know it sounds cliche, but this is what patients talk about with me, whether it's their job, the adventures they've been on, their family, their friends or children, their hobbies. Often it's related to a religious or spiritual belief. But patients suffering with depression have a gaping hole here. Instead of sharing outwardly with me, they're inwardly focused. This isn't about introversion. This is something deeper. This is something that's truly missing from their existence. In Western medicine, we use the Greek word anhedonia, literally meaning not having pleasure in doing things. Have you heard of this word when we describe depression or other mental health conditions? Anhedonia, it's often paired with loneliness. And sometimes it's so severe that patients don't even appear to care about their surgery outcome. It's like they're totally numb to the fears and apprehensions of the surgery. They don't ask questions, they barely engage with me at all as their anesthesiologist before they're going into this medical coma. This doesn't necessarily mean they're suicidal, but it suggests that they're deeply disconnected with themselves and those around them. They also tell me they're numb to the world, numb from feeling pleasure and even pain sometimes. Ultimately, numb from the sensations of meaning and connection that other patients are sharing with me when the anesthesia or the ketamine kicks in. Western medicine typically focuses on reducing the negative symptoms that patients with depression experience. We call these negatively valenced. This is how we objectively attempt to measure patients' mood and their depression severity using questionnaires like the PHQ-9. These questions pick at the presence or absence of negative symptoms, like feeling bad about yourself, feeling hopeless, or not having energy. To justify using these medications, we literally want patients to score lower on these questionnaires to prove that they're experiencing fewer of the negative symptoms. We consider a successful medication trial one that helps patients feel less bad, like less bad about themselves, having less insomnia or trouble sleeping, or less suicidality. This is very important, no question about it. But is this what patients really care about? Do we want to remove disease, or do we want to feel better about ourselves? They are not the same thing, and conventional medical approaches don't address both of these equally. But what do you think? What's your experience at the doctor's office been when you discuss your mental health? Let me know in the comments below. And if this is resonating with you, hit the like button and subscribe to keep up with all of my self-empowering content based on my medical experience here in surgery and in the altered states of consciousness that we usually don't have access to. Instead of just reducing suicidality, hopelessness, or worthlessness, patients suffering with depression are also looking to improve the positive valence, or the positive symptoms associated with our mood. This includes things like social connection, purpose and meaning, optimism and self-confidence, so that we can function better and show up for ourselves and our loved ones. Ideally, we would pursue treatments that reduce negative valence symptoms and increase these positive valence symptoms. But do we have any treatments in modern medicine that can address both? The latest innovations we have in treating depression by increasing positive valence symptoms are actually ancient treatments. They are treatments that don't just focus on neurochemistry, but also on experience and meaningful interactions. I'm referring to experiences that probe altered states of consciousness. This can be internal, like in deep meditative states, or in our REM sleep when we're dreaming at night. Or it can be external, like with ketamine, under anesthesia, or through psychedelics. Disclaimer, not all of these are legal in the United States, and I'm only condoning legal avenues to be very clear. What's remarkable is that these modalities can provide valuable insights into our self-representation. They can give us a rich depth of meaning and connection that can sometimes rapidly and sustainably lift my patients out of the stuck cycles and loops of depression. I became fascinated with this early in my work with IV ketamine and the stellate ganglion block, where I found some patients to improve their mood based off of the standardized questionnaires. Meaning, joy, and connection are just a few of these positively valenced symptoms that my patients find valuable in their healing journey from depression. It's why I love the work I do with ketamine and the stellate ganglion block, because it helps give patients what they want rather than what conventional medicine conveniently can provide. I'm not against conventional Western medicine, but I am opposed to being tone deaf to the needs of patients who are struggling with depression. I believe health is much, much more than simply the absence of disease. And it has to do with that meaning, purpose, and connection that patients keep telling me about, whether they're fully awake or whether they're in that altered state of consciousness. But what do you think? Let me know in the comments below, and let me know what else you want to learn about from this more holistic view of medicine.